Okay, so for the first question, for critical thinking questions, it is based on your first impression of the patient's actions and appearance. What do you suspect she is suffering from? I put the patient could be suffering from a mental disorder. It can be shown by the action she was doing, as well as her appearance, such as the dirty clothes, the smell of body odor, and urine. Um, It also could be substance abuse because when she was being checked out by the nurses and hospital staff, she asked for a bottle. Don't know a bottle of what. The next question is, what short and long-term health risks would you suspect the patient faces? I put for short-term risks, it's hygiene problems due to the lack of personal care, and then starvation due to she probably had no access to food, that water. And lastly, for short-term risks, I put she probably had a risk for an injury, UTI, a skin infection due to her just wandering around. For long-term risks, I put substance abuse and or drug abuse, and accompanied with that depression, anxiety, and delirium. Third question is, why do you think the patient's hands are shaking, and what do you think causes her confusion and combativeness? For me, the shaking of the patient's hands, it can be caused from loss of energy. The loss of energy can be caused from abuse, weakness, no food or water that she was not getting. It's affecting her system. And then her being confused, her confusion and aggressiveness again can come from a mental illness or coming off of a substance abuse. All right, the last question is, what assessments do you think are needed for this patient? The assessments that I put are needed for her would be definitely a mental status examination and a physical examination. And then also many lab tests that would need to be done, such as CBC, blood sugar, urine, liver, and renal function. And all of these labs can help find out what happened to the patient. Right, and then lastly, for the research question, it is mental illness management includes both pharmaceutical and therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it sufficient? What could make it better? So I put for pharmaceutical methods, they really cannot completely heal the mental disorders, but it can support and control the signs of mental illness. Some of the medications that came across for me were antidepressants. Those are used for like people who have suicidal thinking. Antipsychotic medications are very useful to lessen frightening thoughts that people may have. And then stimulants, which these will increase the concentration in patients with mental illness. Lastly, tranquilizers, the help avoid anxiety and make the patients feel relaxed. They're pretty common. And they also provide or used for better sleep. And then for therapeutic methods, the most used one or the major one is psychotherapy. This treatment is usually given by a mental health executive. There are different types of psychotherapy that are done. Some of them I saw were psychodynamic therapy, cognitive behavioral therapy, and humanistic therapies that can be done, as well as just therapy. What they do is, or the main advantages of it, it will help to explore emotions, conduct emotions, ideas, thereby enhancing an individual's health. Therapy is a talk therapy, and it helps people with a broad variety of mental illnesses and emotional difficulties. The major point is for the psychotherapy, along with medications, to be a successful method encouraging and curing the patient. Lastly, the support of insurance. It's also very important in mental illness management because the Medicare and Medicaid is also helping greatly in mental health management. It goes along with preventative care. Insurances do have policies and plans for preventative assistance and mental health assistance. And by that being said, it is sufficient enough nowadays.